I got this phone call on a Tuesday afternoon while I was playing disc golf in Indianapolis, and it was Dr. Wilhelmina Jala, the Minister of Health of Liberia. She called me and asked if I had been paying attention to the numbers, and I said I knew they were rising, and she said, well, if you saw the newest numbers, you would be alarmed, and I was wondering if you're willing to come back. We really need your help. When I hung up with her, and I just sort of paused, and all these things were running through my head, sort of the conclusion at the end was, I think I have to do this. And then I actually called Ben Gaston from the park that afternoon, and that was his response as well, was, I think you have to.
Going to Liberia 2 or 3 times a year has been tremendously rewarding for the Liberians and also for Mike. And that translates into a lot of energy and vitality that he has when he comes back. He's not, by any stretch of the imagination, just going through the motions when he's back. Every day has meaning for Mike.
When I first got there, I was unaware that my skill set, being a respiratory therapist and pulmonary researcher, would be so useful in Liberia. I thought I was just sort of going over to help with this general medical clinic. And then it just was really apparent once I got there that every hospital I went to, every clinic I went to, all of their sickest patients were respiratory patients, or at least almost all of them.
I can tell you that the resources are extremely limited, and when I was there really wasn't any oxygen available. There really weren't ventilators available.
Once they found out what I did, they were very excited to have me help, and the work was just, never ending. In the fall of 2011, I met Joseph Moore, and he expressed interest in opening a school, and it seemed impossible to me. It seemed like something bigger than me that I was not capable of doing. And then, by 2012, Joseph had set up everything except for, the curriculum and accreditation of the school and that kind of thing. It started as a discussion, and then before I really had a chance to say yes or no, a guy said, "Here are the keys." The team running this, what they called the incident management system, and it really was like a war room. They were meeting 7 days a week, from 8 in the morning until 2 in the afternoon, and they were representatives from literally all over the world. And once I submitted this brief to the Minister of Health and she endorsed it, I then gave a presentation at the IMS meeting to all of those people. There were a bunch of bills going through the US government last year to basically send money and resources to COVID hotspots internationally, out of the idea that would not only be humanitarian, but would hopefully prevent that from coming back to the States, right? At that time, Liberia wasn't included, and apparently due to what they were hearing from us, they added Liberia, and $1 million was added to the budget specifically for COVID response in Liberia. Actually, those partners that I worked with and the respiratory team in Liberia are currently using those funds right now, 7 months later, to build oxygen plants in Liberia.
I went to Mike and I asked the question if it was possible that the drug we were using would raise the intracellular pH and kill SARS-CoV-2. And so Mike was an ideal person to track down the answer, and he did a spectacular job. He collaborated with virologists, and he had a lot of experience in dangerous viruses, having worked in West Africa during the Ebola pandemic.
I think I would help in a lot of places if I were there, but there is something about Liberia that keeps me going back, and it's Liberians. It's a wonderful place to work and a wonderful people to work with.
Well, Mike has always been extremely collaborative and gets along extremely well with people. He's also very well trained and very smart and understands biology and the things that he does in respiratory medicine extremely well. So it's sort of a perfect combination of energy, collaboration, being good-natured, and being smart.